Hello, hello, good evening, all of you. Am I audible, guys? Hello. Wow, congratulations, Veeran. Very good. Okay, all the best for your future. I'm so much happy to hear this beautiful news. Congrats. So, hi everyone. So, yesterday we already completed. Yesterday, some network issue is there, so I can't able to do 1 hour live. So, I just skipped just disconnected my live due to network issue. I think yesterday just a half an hour I do the live. Just a half an hour is only our live session. So now, today, maximum I will do my best in this. He suggested a biopsy of the oral mucosa. He suggested a biopsy of the oral mucosa. What CPT code covers a biopsy of oral mucosa? So, oral mucosa related code. So, what will be the answer for this question? Guys, just solve the question at your own and uh, drop your answers in the comment box. And wishing you a Merry Christmas. Most welcome, Viren. I know most of the peoples are in their celebrate are very busy with celebrating Christmas. But whatever, I think that I have little bit time for this. That is why I'm doing this live, guys. So please drop your answers in the comment box. So what will be the answer for this question? Answer for this question. What is the answer for this question? Biopsy of oral mucosa is mentioned. Biopsy of oral mucosa. Actually, the CPT code for this biopsy of oral mucosa is um, yes, guys, please drop your message. Guys, I already uploaded a complaints and regulatory, coding guidelines question and anatomy questions. Top 10 anatomy and coding guideline question in my YouTube channel. So if you are not watched the video yet, just check my channel. I uploaded recent questions. Okay. Solve this question, guys. 78. Next one, 79. After experiencing rapid heartbeats, Karen underwent an electrophysiology study. So, CPT code pertains to this procedure. What is the CPT code appropriate for this question? Maximum try to solve every questions within 2.4 minutes because a lot of students messaging me daily because they don't have any enough time to complete the 4 hours. So it's a common question for how to manage the exams timing. Okay, that's a very important and common question. So only one is only one way. Maximum practice. Try to take every question within 2.4 minutes. That is only one way to find the answers. Okay. Next, while gardening, Chole got a thorn embedded in her hand. She went to healthcare provider who removed the foreign body. So, which CPT code covers the removal of a foreign body from soft tissue? Solve this question, guys, then send me your answers through my mail ID. Yes, dear, yes. Actually, in this question paper, in this CPC mock test, I will cover every question, I mean, every series. Okay, so you can expect these areas, these questions in your exam. The term hyperglycemia means, actually, this is a repeated question. The term hyperglycemia means low blood sugar level. Option B, normal blood sugar level. Option C, high blood sugar level. Option D, blood without sugar. Correct answer, Kartika. Very good, dear. Next, Julie was diagnosed with iron deficiency anemia secondary to chronic blood loss. So, which ICD-10 code is appropriate for this diagnosis? Kartika, correct answer, dear A. Very good. Next, yeah, it's a E&M service code. Nathan visited the clinic with the flu-like symptoms. The doctor took a brief history, focusing mainly on the respiratory system, which CPT code represent this level of history taking. The correct answer, dear. B. 99202. Correct answer, guys. Everyone just check the code because everyone's have a lot of confusions in the E and M. I know. I got everyday messages from lot of students, those who are confusing in E and M. Okay, so actually, and it's little bit confusing area, but here, Kartika, your answer is right there. Very good. Okay, 99202 is the answer. Okay, because the patient has some like symptoms only. Okay, so um, so the answer is 99202. Next is a most repeated question. Dr. Harris diagnosed Grace with hyperthyroidism and recommended a partial thyroidectomy. Which CPT describes the this procedure? It's a repeated question, guys. Thyroidectomy code is the most repeated one. So try to solve this question. Actually, one of my student Viren passed his exam successfully. He cleared. Uh, I'm so much happy because the only one live, Veeran is not my student because he just joined my live only. But he joined it again, then tell me about the happy news. I'm so much happy, Veeran. Um, Thank you for your support and God bless you. And students, if you want mock papers related to CPC examination, or if you are interested to join my class, you can just tell me, just DM me. Okay, I will pin my number because, guys, this live I'm just sharing the questions only, not a detailed class, detailed every question paper. Like I have a lot of question paper. December month question paper is there, but I just sharing only through my class only. Okay, for my students only. So if you are interested to join my 10-day CPC workshop program, you can join. I will share all the PDF through my class only. Okay, so if you want, just DM me. I'm pinning my number. Okay, I'm just pinning my number. So if you are interested, just join me, guys. Because that is very helpful for you. Okay, I'm sharing each and everything related to December month question paper. I know because a lot of students are taking their examination date on December, and some of them are January. January, a lot of changes are there. So I will share the changes through my classes only. So if you are interested, just DM me and join my class just for 10 days. After completing the class, you will become a medical coder. Yes, 86. Uh, so actually, Kartika, right answer. Yes, 85 answer is correct, dear. Okay, 86. According to Medicare, the 3-day payment window rule refers to option A, the time frame in which a patient must pay their bill. Services provided to a patient 3 days prior to their inpatient admission. Option C, the time frame in which Medicare must process a claim. The period within such a patient can distribute a charge. So, what is the answer for this question, guys? Okay, Kartika, 27th. Okay. Anyway, all the best wishes for your exam. Kartik Patil. Okay, Kartik, not Kartika. Okay. All the best wishes, dear, for your exam. So, what will be the answer for this question? Actually, it's a HIPAA related question. Huh? HIPAA related question. So, what is the answer for this question? So what will be the answer, guys? Lavanya Shalini see the time frame in which Medicare must process a claim. That is the answer. What about others? Shalini, correct answer. Lavanya Shalini, correct answer, dear. Okay. C is the option, the time frame in which Medicare must process a claim. And next is also a coding guideline question in ICD 10CM. How should unspecified codes be utilized? Option A, frequently as they are easy to use. Option B, only when the documentation doesn't provide more specific information. Option C, when the coder is unsure about the specifics of the condition. Option D, in any situation where a quick code is needed. Unspecified codes be utilized. Yes, C, correct answer. Lavanya also correct. Sandy Rose, correct answer, dear. C. When the coder is unsure about the specific of the condition. So unsure, we are not sure about the specific condition. So you have to use unspecific. Uh, Unspecific, not specified. In our documentation, they have not specified a kind of uh, the code. I mean, the site you have to take unspecified code. Very good. Sophia had recurrent UTI. So determined cause, her physician performed a cystography. So which CPT code pertains to this procedure? Nice name, Santi Rose. Karthik, correct answer, dear. B. Very good. In CPT coding, what does a modify 25 indicate? A repeat procedure by the same physician, bilateral procedure, multiple procedure, significant and separately identifiable evaluation and management service by the same physician on the same day of the procedure. So, what is the modifier 25 definition? What is the definition of modifier 25? Actually, it's a very easy question. You can expect this question in your CPC examination. 89 D, correct answer, Karthik and Rasna. Rasna, Rashi, correct answer, guys. What does the term cardiomyopathy refers to? Option A, inflammation of the heart muscle. Option B, enlargement of the heart. Option C, disease of the heart muscle. And option D, blockage in the heart arteries. Hi, Karthik. I'm from Kerala. Karthik, are you from? Yes, everyone. Correct answer. Cardiomyopathy. Padi means disease, right? Myo means completely related to muscles. Heart muscle related. Okay. So disease of the heart muscle. Correct answer. Sandy. Correct answer. Dear Lavanya, Karthik, everyone. Correct answer. Yeah. Let, next is it is a HIPX related code. It's level code. George received an infusion of Remicade for his Crohn's disease. What HIPX level 2 code correspond to the Remicade infusion? Okay, Maharashtra. Nice. Okay, let me check this question. After that, uh, what is this question's answer? Crohn's disease is mentioned. Okay, so J1745 code for a Mm, yeah, that is include Remicade also, dear. Correct. You are right. That that code contained the Remicade. Option A, J1745 contained Remicade infusion. So, Karthik, correct answer, dear. Okay, and what about Lavanya? Ma'am, January month I plan my exam. If mm, January month guidelines are changed, so exam is difficult or not? Actually, dear, yes, some guidelines are changing in January. That is right. Not a big changes, but a little bit changes are there. Okay. So, exam is actually it's a 50-50, dear. I don't know about that because nowadays someone says that the exam is very easy. For some students, exam is easy, but some students saying it's super difficult. No, completely difficult exam. Someone says it is based on your luck and uh, yeah, because normally examination is not only easy but also it's a difficult exam. But if you are understand every concept, you will get the good mark. Okay, so in January, upcoming month, uh, there is a little bit changes in the guidelines and also some codes are changing. Okay, so that will affect the examination. Surely that will affect the examination. But it is based on your luck, dear. Uh, I'm not sure about that. The exam was difficult or not. I'm not sure about that. But mm, that is the things. Yeah, Rasna. Okay, before shit. What is next? When it comes 93, when it comes to Medicare fraud and abuse, what does upcoding refers to? What is upcoding? Exam not difficult. Okay. Yeah, actually, Karthik, it is based on your luck, dear. Okay, it is based on no everyone have different question paper. Case study is little bit hard. Yes, case study is little bit difficult. I know because everyone saying that case study is too hard. And we never have have not sure about the case studies questions. That is the main thing. All the other questions, all the other series exam areas are, I'm sure we are sure about that. These kind of important areas are asking repeatedly, but in case studies we are full of blank because don't have any idea about that how questions are came under the case studies. Okay, so practice yourself, then uh, you will get nice. So, Rasna, actually B is the answer. High service code than what was performed. Billing a higher service code. Higher service code is the answer here. Okay, B is the answer for this question. Next, Max complained of fatigue and frequent infection. His doctor ordered an immunoglobulin test to check his immune system's health, which CPT correspond to immunoglobulin test. A is the correct answer. Very good. Hi Karthik. Okay, ma'am. I'm from Maharashtra, but my exam center is Ahmedabad, Gujarat. Exam date. Okay. Okay, dear. 95 exam date not available in this month. Because December month is, getting date is very difficult here because lot of students who passed their medical coding course, I mean, who completed medical coding course are ready to do their exam at December month. Everyone are planning to write their exam on December month because it's a year end, right? So that is why you know for getting slot is very difficult. 95, when a patient is admitted to the hospital for high fever and is later diagnosed with sepsis, what should be the primary diagnosis according to ICD-10 guidelines? Yeah, B correct answer, sepsis. Very good. Next, Jason went to the clinic after noticing a sore that wouldn't heal inside his mouth. Doctor performed an excision of the oral lesion. So, what code, CBD code represents this procedure? Hi, Sandy, correct answer, dear. Karthik, Prasna, Sandy, everyone's answer is correct. Yes, Prasna, correct answer, dear. Very good. Correct answer. Next, Nancy was fitted with a below the knee artificial limb after her leg amputation with CPT level 2 could represent this prosthetic. See, Rasna, correct answer here. C, very good. Answer is correct. Okay, so 98 one. Tyler had a lump on his thyroid that endocrinologist performed a fine needle aspiration biopsy. Which CPD code pertains to this procedure? Appropriate answer. Okay, so again, printing mistake, guys. Just skip the question. Okay, so this 99th one, guys, because every question paper are it's a printed format, so it contains a lot of questions, so it become just combined form. So that is why. Sorry for the uh, delay. Okay, 99. Lily felt a sudden blockage in her nose. The doctor diagnosed a deviated septum and recommended a septoplasty. So, which CPT code pertains to this procedure? Septoplasty related. Okay.